Anytime someone in the ER, in my opinion, whether you're an attending, a nurse practitioner, a PA, whatever your practice level is, if you're an employee of the emergency department who works on furthering the disposition of a patient that we have seen, and you are going to use it, unless you're absolutely joking, use the terms, I got to sell this admission, I think you ought to think twice about your own process that you've taken so far. Did you get all the data that you possibly could? Did you think it through in a logical manner? Have you done what you can do to the extent of your abilities and capabilities in the emergency department before you tried to move this forward? It's exactly the same as hearing someone say, well, I rolled the dimer dice and I lost. I hate that. Now, some of that's biased. My research area was in PEs and DVTs. You know, I'm biased because I'm really biased for a good reason. There's a finite niche of patient population where that particular test applies, and you really ought to try and make yourself expert on knowing the data on where that test applies, when you're about to order it inappropriately, and when it's appropriate. So when I hear, I rolled the dimer dice, I immediately get a little hot-headed and go, did you use your education and your brain before you painted yourself into whatever corner you're trying to paint yourself into? Same thing when you say, I got to sell this admission. If you, as an ER provider, an adequate, intelligent ER provider, feels that they're going to have to sell something to someone else, I don't think you've done your best, or you would give yourself credit for saying this isn't a sales pitch, or you'd have the gumption to say this doesn't need to come in. That's just my thoughts.